So chapter 14, integration of nervous system functions. Remember, at the end of the day, we need to bring all sensations from the body up into the postcentral gyrus. Now, only special senses are usually kind of integrated elsewhere. All other somatic sensations will be integrated in that postcentral region. So let's take a look at sensation and what we mean by sensation versus perception of sensation. Now, when we have perception, we have a conscious awareness of that sensation. So we have the sensory receptor firing, a nerve impulse carrying that sensation into the spinal cord. Spinal cord has another neuron that sends it into the brain. So usually we say it takes about 3 neurons to send any information from your limbs, extremities, to the brain. Now, when we are conscious, we're awake. We will always have that perception of that sensation. When we discuss it, keep in mind that the opposite, right? You can have sensations, but you don't perceive it. Like what happens when you're in surgery and they give you a medication that knocks you out. So let's say you're undergoing general surgery. When they give you medication for general surgery, not only are you asleep, but you're also paralyzed. Now, in that concept of, you're asleep, you're paralyzed, you're not moving, you're not aware. When I do make an incision in your body, I still activate sensory receptors for pain. The signals still fire upwards into the brain. We're not cutting those signals off. But because we're not conscious, our perception of that pain is not received. So you're not aware you're receiving that sensation. But once you wake up, you know right away that it does hurt. So if you've ever had any kind of surgery, you know when you wake up, at least if they did not give you a local anesthesia as well, most doctors do give you a local anesthesia at the incision site. So then when you wake up, you don't have this sudden increased amount of pain. That's just debilitating. What happens with the local is that it lasts longer. So then even though you've waken up, you have a little bit of numbness instead of just frank pain coming at you. Eventually the numbness wears off and then the frank pain comes at you. So then you, at that point, have conscious awareness. You'll have a perception of that sensation. So in terms of steps of sensation, you need a receptor. The receptor converts that sensation to a series of action potentials, which will then be transmitted by a sensory neuron to the central nervous system. Within the central nervous system, the spinal cord has a series of tracts, pathways. Some of these pathways we're going to talk about later on in this chapter. Those pathways carry similar signals from similar regions of the body. So if you have pain in your fingertips, right? Doesn't matter if it's your index versus your ring finger. You're going to carry those pain sensations upwards in the spinal cord as part of a given pathway. Usually a pathway we call the spinal thalamic tract. So usually sensations for certain modalities will be carried along the same tract. So if you have temperature, tickle, itch, they'll be carrying out around in a separate system, a separate pathway for sensations in your spinal cord. Now, later on in this chapter, we will kind of give names to those. Right? We just mentioned the spinal thalamic that carries pain, but it also carries other types of sensations from your limbs. There are other pathways that carries other sensations. Touch is another sensation. Well, you have a different pathway that carries the sensation of touch. And depending on which limb we're talking about, we'll have different areas of the spinal cord for those sections of your limb. Once in the spinal cord and in the brain, we need to carry that action potential to the postcentral gyrus. Remember, your postcentral gyrus, we're going to give it a specific name later on, is called the somatic sensory cortex. All somatic sensations end in that area, and even some special senses end there. Now, when we look at type of sensations, we have general versus special sense. Now, general sensations are sensations you find throughout your whole body. So these are sensations you will see in your fingers, in your arm, in your face. So they're not just localized in one part of your body. So these general sensations right here, this slide is a little bit more informative on what these sensations are. So if you look at general sensations, we'll have general somatic from the skin, muscle, and the joints, and then visceral sensations. Now when you look at the visceral sensation, it's only pain and pressure. And we'll talk about how that relates to us in just a second. In somatic sensations, there's a whole bunch of them. Touch, pressure, proprioception. We're going to use that a lot. Knowing where your limbs are in time and space. Temperature, pain. They miss a couple. Tickle, itch is another, or a couple other sensations. When you are getting tickled, you know exactly where you're getting tickled. There's no vagueness, right? It's not when somebody tickles you, you're like, oh, where's that coming from? Right? You know where you're getting tickled. When you get a cut, you know exactly where you get that cut. So in terms of these somatic sensations, they're all easy to localize. You know exactly where you get that sensation. Visceral sensations are different. When we talk about visceral sensations, right, there's pain and there's pressure. What happens? Well, you've ever gotten diarrhea. I don't know, nobody likes talking about diarrhea, right? But you have diarrhea and then you're in the bathroom just kind of leaning over, your abdomen is cramping up. Can you point to one spot where it cramps up more? No, there's just a generalized diffuse pain, and that's about it. That's a visceral type of sensation. Now, another example, when we hear of people having a real myocardial infarct, a real heart attack, what happens is they basically do complain about pain, but this is a big one they feel. All right, increased pressure in the chest. It feels like an elephant is sitting on top of their chest. They can't take a deep breath in. They almost have to take shallow breaths, which makes it harder to breathe. Well, what happened is that pressure is basically, right, and what they'll say is just kind of spread throughout the thorax, right? Well, that pressure is very hard to contain. It's spread throughout the whole thoracic region, and it's really hard to decipher whether at times the pain is in the chest or even in the lower chest, upper abdomen area. So sometimes things like gastritis, GERD, gets misinterpreted for an MI. So because visceral sensations are so poorly localized, it can get confused with other things. Now another example of this visceral kind of sensation with just having pain and pressure is if you have had the joy of giving birth, right? Sometimes you might have had an epidural. When they give you an epidural, the epidural takes away the pain. The pressure ones, the pressure sensations in the viscera are harder to actually kind of get rid of. So you feel the pressure even though the pain receptors aren't there anymore. You don't have the sensation of pain, but you do feel something's like pushing out of you, right? That's a pressure that you feel. And we want that, or else you won't know when to push, right? So usually what happens when we give people an epidural, when the active labor is actually starting, when you're ready to push, usually we want the amount of lidocaine to decrease a little bit. Not a lot, just a little bit. We want to make sure that we know when to push. And then when you push, it sounds bad, but you can feel it, right? You pushing the baby out, right? So it's a great thing. You have a baby afterwards, right? Or about your whole lifetime, you'll have a baby afterwards. So that's great. So what happens is you have all that in terms of visceral sensations. Again, very poorly localized, only containing pain and pressure. When we look at these sensations, we'll also note that in these sensations between general and special are carried by different types of receptors. General sensations are carried by primary receptors. When you look at primary receptors, you'll note that here you see what looks like an onion if you look real closely, like Shrek, right? So you have lots and lots of layers, like an onion. So this Pacinian corpuscle right here is there for the sensation of pressure. They're very deep into the hypodermis. They're deep into the real deep areas of your dermis. So we're not talking about they're very superficial on the epidermis. So in order to feel pressure, you can't just barely touch part of the skin. That's not pressure. In order to feel pressure, you need to push down a little bit. The more you push down, the more layers you activate, and the more action potentials, which then the brain interprets as increased strength of that stimuli. Now, when you look at the Pacinian corpuscle, the corpuscle itself is the receptor. The receptor is going to be directly connected to the sensory neuron. So right here, once you activate the receptor, an action potential is triggered onto its axon and carried into the spinal cord. That's going to be different than what we see for special senses. Now, special senses are things we only see in the head, right? So, sight, smell, taste, as well as hearing and balance. We've all seen Elmo before, right? And they talk about the 5 senses, and it's always smell, taste, sight, hearing, and then they talk about touch. Touch is not a special sense, right? It's a general sensation. What is a special sensation? Is balance and equilibrium. And it kind of makes sense why. We're the only animals that are going to be on 2 legs only. Because we are only on 2 feet, 2 legs, we're bipedal. If we fall, not only do you have do you fall, and you fall from a higher vantage point, and then you can cause more damage, but because we only have 2 legs, it makes it easier to fall. So what happens is we have this balance system in our body that usually prevents falls. Even though as we age, our balance gets to be a little worse. There's certain medications and drugs that can affect your balance, and you can have infections that can affect your balance. Balance is incredibly important, specifically in us, because we're only on 2 legs. If you have 4 legs, like dogs, like cats, like most other mammals in the world, you don't have quite as much need to have redundant areas of the brain for balance. Remember, even if you've ever seen a dog that only has 3 legs, their balance is actually pretty good, even only on 3 legs. So what happens is, being on 2, you need a little bit more part of your brain to actually help with that balancing. All right, now, for all these special senses, we're going to have what are called secondary receptors. The difference between a primary and a secondary receptor is that a secondary receptor actually has a cell specific for that special sensation. So for the taste sensation, what happens are we have taste cells. Taste cells are found as part of those little dots you can see. Now, I want you to go home and look inside and look into your tongue in the mirror. As you look in your tongue, you see little red specks. Those red specks that we see in our tongue are called papilla. And then inside the papilla are taste buds, right? So we have about at least 5 primary taste sensations: sweet, salty, sour, bitter, and then the last one's umami. So those are the sensations we'll talk about more in chapter 15, but I'm just introducing to you guys right here is that those are the sensations that you can't really describe without using that word. How do you describe what salty is without using the word salty? All right. How do you describe to somebody what chicken tastes like, which is umami? Right? It's really hard, right? Because we think everything tastes like chicken. So these are our main taste sensation. And we have one of those taste sensations bind to a taste cell. It causes an action potential in that cell. The cell then releases a neurotransmitter, and the neurotransmitter will stimulate branches of certain cranial nerves. So if it's for taste on the anterior 2/3 of your tongue, well, you're going to have taste cells release action potentials on your facial nerve as you bring that sensation in from the anterior 2/3 of the tongue. So you have a neurotransmitter that has to be released for that to happen. Now, the rest of these, I know I'm missing some of these on your notes, so if I'm missing them, please just write them in. Types of receptors, we've talked about proprioceptors already, so I want you to know them again. Associated with joints and tendons. And these are the types of receptors I want you guys to know for the test. These are very good, I wouldn't say easy, but they're very good type of questions that are like either a simple multiple choice or matching questions. So the 4 I want you to know are Merkel's disc, Meissner's corpuscles, Pacinian corpuscles, and this one right here is the one I think that I didn't add on, is the Ruffini end organ. So these 4 are the ones that are, again, matching questions. It shouldn't be too hard. If you just, even if you want to make it into a note card, this would be the best, type of material to put into note cards. Something that is very specific. Merkel's disc, light touch, superficial pressure. That's it. Where do you find it? Epidermis. So things that should be on note cards are things that have a lot of facts that are easy to memorize. So Merkel's disc right here. The good thing about Merkel's disc, sometimes called tactile disc, we've talked about in chapter 5. The bad news, that's like 2 months ago, right? So you guys have probably forgotten all about this by then. So Merkel's disc right here contains branches that end as flattened expansions and associated with epithelial cells. They're found in the basal layer of the epidermis, and the most important part is that they convey the sensations of light touch and very light superficial pressure. That's it. The second one, Pacinian corpuscles. Pacinian corpuscles are going to be found much deeper in the integument. They're found deep in the hypodermis and in the reticular layer of the dermis, which is a deep dermis layer. So we're talking about real deep areas of your integument. So in order to activate this, you need deep cutaneous pressure and vibrational sense. Now, I used to have kind of a tuning fork. If you guys have ever seen a doctor with a tuning fork, they have ends on these tuning forks that looks like little round discs that are on there. And those tuning forks that we use, we hit our, the base of our palm. And what we do with those tuning forks is I put it on a bony prominence, right? Now when we put that tuning fork on a bony prominence, what we're testing for is the loss of vibrational sensation. People that have diabetes get neuropathies. Those neuropathies usually start very distally, either distal fingertips or distal toes. And what happens then is, if you lose that sensation in your tips and your toes, if you hit something, if you step on something, you might not know you're actually injured, that you've had a cut. And instead of just having a cut, you put a Band-Aid on, now you don't know it's there. So you don't take care of it. And now that cut becomes a fulminating infection. So if you have diabetes, what happens is you have high blood sugar. So more sugar, more glucose in the bloodstream than somebody that's normal. Do you know what loves glucose? Bacterium, right? So bacterium, exactly, takes that extra, right, sugar, and then they start to grow and grow. Eventually, you might need to amputate that, right? All because of a little cut. Usually, we can test it, and we do start testing it, and if somebody has diabetes, we start testing it early. And we do vibrational sense to make sure that they can still have somewhat of a sensation. And if they do start losing that sensation, we have to make sure that we are going to monitor it. And we make sure that they monitor it every day. So these Pacinian corpuscles, right? Vibration is one of the main senses that diabetics lose pretty early on. So it's one of those we check. The other one is this. This one's pretty cool. Now, when you have a chance at home, you don't need anything specific. All you basically need is a see if I can find 2 points, right? I just need something that has 2 points. It can be 2 pins. And what I want you to do at home is this, right? In your fingertips, I want you to just kind of use your fingers or use those pins and push down at 2 separate points, right? And then find a time, right, when you can't feel 2 separate points anymore. We call those 2-point discrimination. What 2-point discrimination allows us to do is it allows us to go into our fingers, go into our pockets and feel for your keys and immediately be able to tell without even looking at it which are your car keys and which are your house keys. So what happens is in certain areas of the body, we want greater discrimination of 2-point touch. Makes sense that you have greater sensitivity there in your fingertips because you are usually using your fingers to grab things. If you put 2 sets of, and I do want you to figure out at what point do you not feel 2 different points, right? And then I want you to check on your forearm and see at which point do you not feel 2 separate points, right? What we see is it takes a very little space, right? When you have just 2 millimeters to 3 millimeters apart, at that point, when you push down, all you feel is 1 spot. Anything beyond that, 4 millimeters, you can feel 2 separate points. It allows you to feel the different ridges when you are fumbling around for your keys at night. And we've all been there. You go to bars, right? Or you're, kind of in class or on the way out of class. Now, most people are a little bit more scared to be downtown. And when they take classes downtown, they want to be ready to go out. I love downtown, but what happens is when you kind of move around and feel for your keys, just by touch, you can tell which one is which. And again, if I would put 2 sets of keys on your forearm, all you would feel is just cold steel. You won't be able to feel those ridges. You don't have that kind of sensitivity. Now, the weird one is this. Your tongue is actually really sensitive. Have you guys ever eaten anything that, I think people make excuses about it sometimes, that might not taste bad, but the texture is really weird? Right? Now, there's one type of, one very, very delicious type of fruit found in Southeast Asia that a lot of people think smells really bad. Right? I think it smells really good. Astrid, what do you think of durian? Smells good, doesn't it? Right? So only Asians think it smells good but even then, what happens is, right? A lot of hotels in Asia, they really ban this fruit, right? This fruit really smells like really bad cheese, and the weird thing is, it tastes really good. It has a really benign taste to it. It's sweet. It's got a custardy kind of smooth taste, but you would imagine something a lot worse with the smell. When people actually bite into it, they're not expecting something that is so almost creamy when they bite into it. So when they bite into it, they kind of freak out. All right, they're freaking out even before they bite into it with the smell. But after they bite into it, they're freaking out because of the texture of it. So texture in your tongue, in your mouth, plays a big, big component in how we like things or not. You guys ever watch Bizarre Foods? He always talks about the mouthfeel of certain things, right? And another example is, anybody's ever eaten tripe before? Right? Cow stomach? I know, right? Cow stomach. It's hard to sell, so we use the word tripe. Tripe, that sounds great, right? So if you've ever eaten tripe, the one thing about tripe and cow stomach is that cow stomach is very folded, right? And when you bite into it, it's very kind of mushy, and it's got that weird kind of like biting into, something that is thick at the same time, right? It's not as thick as like a piece of meat, so it's squishy too. And what happens is some people really get turned off by it, right? I don't mind it, but I try to feed it to my kids. My daughter will not even look at it, right? She just like, no, all right? And it could be because we went one time to a restaurant and they were cooking it. It wasn't very clean restaurant. So what happened was that the stomach itself and the intestines we were eating had a smell to it. Yep, that was it. Never tried it again, right? So that's one of those things where mouthfeel, texture in the mouth, right? It does play a role in if you would like something. Anybody's ever heard of lutefisk? Now, I used to live in Minnesota. In Minnesota, a huge Norwegian culture. Very, very different. Huge Scandinavian culture. Vikings, right? I know, right? Minnesota Vikings, right? So what happens is we can make fun of them all they want. And even the food they have, called lutefisk, is ridiculously weird. I eat just about anything, but that one I'll probably have to share with everybody first, or somebody has to share it with me. There's no way am I spending money on it. I have heard my friends talk about it, and what lutefisk is this, right? They actually cure this fish, this white fish, with lye. Lye, yes, lye. And then, in order to make it non-toxic, you have to wash it over and over with cold water. By the time you wash it, for the matter of weeks that it takes to get rid of the lye, the fish itself is no longer, doesn't have that same texture anymore. The texture is more like petroleum jelly. So then when you bite into it, when you eat like salmon, you expect something that's kind of, right? It's tough, right? It's kind of meaty. This is nothing meaty, right? So when you bite into it, it just gives. It's like eating, petroleum jelly. And the taste itself has no real taste except that whole thing. The whole thing about eating lutefisk is getting that texture in your mouth to see if you like it or not, right? So that is another example of how texture can affect the way we have taste. The last one, Ruffini's end organ, therefore continuous touch or pressure, and very good in the response of stretching of the skin. Keep in mind, you guys have all had it. When you were kids, if you have an older brother or sister, they would grab each part of your arm and kind of squeeze, like wringing a towel, right? That stretching of the skin is going to be innervated by this Ruffini's end organ. It's going to be translated by this. And this is one that I think is not on your, right? So I'll give you guys a little bit of time to review this.